Imagine being told that your bones are dangerously weak, doing exactly what you were advised to do, taking calcium every single day, and then discovering that the real problem may have been completely misunderstood from the beginning. That sounds impossible because calcium has become almost synonymous with strong bones. Milk, tablets, vitamin D, calcium supplements. The message has been repeated for decades. But here is the uncomfortable question. If calcium is the answer, why can some people take calcium for years and still have worsening osteoporosis? Why can bone density remain dangerously low even when their blood calcium looks perfectly normal? And why do doctors sometimes find kidney stones or other complications in people who believe they were simply building their bones? The answer is not that calcium is bad. Calcium is absolutely essential. The problem is that your skeleton is not a bucket waiting to be filled with calcium. It is living tissue, constantly being broken down, rebuilt, and carefully regulated by hormones, minerals, nutrition, and physical stress. And once you understand that system, the entire calcium story starts to look very different. Most people imagine osteoporosis as a simple shortage. They hear weak bones and immediately think, I need more calcium. It sounds logical, but bones are not dead blocks of mineral sitting inside your body. They are active tissue. Every day, specialized cells remove old bone while other cells build new bone. In a healthy system, these two processes are kept in balance. The trouble begins when the breakdown side starts winning. More bone is being removed than replaced. Slowly, the internal structure becomes thinner and more fragile. The spaces inside the bone become larger. The outer shell can also weaken. Eventually, a fall, a small impact, or sometimes even a normal movement can cause a fracture. So the first important point is this. Osteoporosis is not simply a calcium deficiency disease. Low calcium can absolutely contribute to poor bone health, but the disease itself involves the entire process of bone remodeling and bone strength. And this is where a mineral that rarely gets the same attention enters the story: magnesium. Most people know magnesium because they have heard it may help with muscle cramps or sleep. But inside the body, magnesium is involved in hundreds of biochemical reactions. A large portion of the body's magnesium is stored in bone, and magnesium plays a role in bone formation, as well as the activity of the cells that build and break down bone. It also influences two systems that are incredibly important for bone health: parathyroid hormone and the active form of vitamin D. Now, I want to be very clear because this is where health videos often go too far. Magnesium is not a magic cure for osteoporosis, and there is not strong evidence that every person with osteoporosis should simply take massive doses of magnesium and expect the disease to disappear. But if magnesium status is poor, it can become one of the missing pieces in the bone health puzzle. And the reason is fascinating. Think of your body's calcium system like a tightly controlled traffic network. Calcium is not supposed to randomly float around and settle wherever it wants. The body constantly monitors calcium levels in the blood because calcium is needed for muscles, nerves, and many other vital functions. If the body senses that blood calcium is falling, it has emergency systems that can respond. One of the most important is parathyroid hormone, or PTH. PTH is produced by the parathyroid glands, and its job is to help maintain calcium balance. It can influence the kidneys, vitamin D metabolism, and the movement of calcium from bone. In simple terms, when the body believes blood calcium needs support, PTH can help mobilize calcium. That is useful in the short term. The problem begins when the system remains under pressure for too long. Imagine a bank account. You need money for an emergency, so you withdraw a small amount. No major problem. But then the emergency never ends. You keep withdrawing money every week. Eventually, the account begins to shrink. That is a simplified way to understand one possible pathway toward bone loss. Persistent abnormalities in calcium and vitamin D regulation can lead to increased bone turnover and, depending on the cause, more bone being broken down. This is why simply throwing calcium into the system may miss the bigger question. Why is the body struggling to maintain calcium balance in the first place? Vitamin D is another major part of this story. People often hear that vitamin D helps the body absorb calcium, and that is true, but the system is more complicated than taking a tablet and assuming the job is finished. Vitamin D has to be metabolized and activated through a series of steps, and magnesium is involved in the body's vitamin D metabolism. Research from the National Institutes of Health also recognizes magnesium's role in bone formation and its influence on parathyroid hormone and active vitamin D. That does not mean magnesium deficiency explains every case of osteoporosis. It does mean that looking at calcium alone is a very narrow way to look at the problem. You can have a person who is eating calcium, taking calcium, and still has a bone problem because the overall regulatory system is not functioning normally. Now, here's something that confuses many people. A blood test can show normal calcium while a person's bones are still fragile. That seems contradictory until you understand what the body is trying to protect. Blood calcium is tightly regulated because calcium is essential for immediate life functions. The body will work hard to keep the blood level within a narrow range. Bone, in a sense, can become part of the long-term storage system. This is one reason a normal calcium blood result does not automatically prove that your skeleton is healthy. And it is also why a person should never look at a single calcium number and conclude, my bones are fine. The same issue exists with magnesium testing. Magnesium is a little more complicated to assess because most of the body's magnesium is not sitting in the bloodstream. The NIH notes that less than 1% of total body magnesium is in blood serum. That means a serum magnesium test can be useful, but it does not always give a complete picture of total magnesium status. This is not a reason to panic or assume everyone is secretly magnesium deficient. It is simply a reminder that the body is more complicated than one lab value. If someone has risk factors for low magnesium, poor dietary intake, gastrointestinal problems, certain medical conditions, or medications that affect magnesium balance, the situation deserves proper medical evaluation. And now we need to talk about one of the biggest reasons the calcium conversation becomes confusing. People can be taking calcium and still lose bone for completely different reasons. Take corticosteroids, for example. Long-term glucocorticoid use is a well-known risk factor for bone loss. A person may be eating a reasonable diet and taking calcium, yet the medication itself can interfere with bone health and increase fracture risk. In that situation, simply increasing calcium does not erase the medication's effects. The same kind of confusion can happen with stomach medicines. Proton pump inhibitors are commonly used for acid-related conditions, and long-term use has been associated with bone health concerns. The explanation is not as simple as saying acid blockers destroy your bones, but changes in stomach acid and mineral absorption can be relevant in some people. And the medication itself should be reviewed with a qualified healthcare professional rather than stopped suddenly. This is why the phrase, just take calcium, can be dangerously incomplete. If your bone loss is being influenced by a medication, a hormonal disorder, poor nutrition, inactivity, low vitamin D, or another underlying condition, the correct solution may involve finding and addressing that cause. And yes, calcium still matters. But the question is not simply, how much calcium can I swallow? The better question is, does my body have the ingredients and the conditions needed to use calcium properly? There is another point that is often misunderstood. Bone density and bone strength are closely related, but they are not exactly the same thing. A DXA scan measures bone mineral density and is extremely useful for diagnosing osteoporosis and estimating fracture risk. But the actual strength of bone is also influenced by the structure and quality of the tissue. Think of two buildings made with similar amounts of material. One may have a stronger internal design, better support, and better architecture. The other may be poorly structured. The amount of material alone does not tell the entire story. Bone is similar. Its density matters, but so does its internal structure and the way it has been remodeled over time. This is also why a person can become frustrated after taking supplements. They may say, my calcium is normal, my vitamin D is normal. Why do I still have osteoporosis? Because osteoporosis is not a simple scoreboard with one mineral at the top. It is a long-term process. Hormones matter, age matters, sex hormones matter, genetics matter, physical activity matters, protein matters, smoking and heavy alcohol use matter, certain medications matter, and the body's mineral systems interact with each other. Now let's return to calcium itself, because this is the part that often gets exaggerated online. Calcium is not the enemy. Your skeleton needs it, your muscles need it, your nerves need it. But more is not automatically better. Some research has linked higher supplemental calcium intake with kidney stone risk in certain situations, although later clinical studies have not always found the same association. The broader evidence on cardiovascular disease has also been mixed. Some major reviews have not found a clear, harmful cardiovascular relationship at recommended intake levels, while other research continues to debate possible risks associated with supplements. So the honest answer is not calcium causes heart disease. That would be an irresponsible oversimplification. The honest answer is that calcium supplementation should be individualized, and taking large amounts without a reason is not the same thing as treating osteoporosis intelligently. There is also an important difference between calcium coming from food and a large supplement dose arriving all at once. Food usually delivers nutrients as part of a broader meal and diet. Supplements can create concentrated doses, and depending on the person, the dose, and their medical history, that may change the risk-benefit calculation. This is one reason many osteoporosis guidelines prefer meeting calcium needs through food when possible, and using supplements when dietary intake is insufficient or when a healthcare professional specifically recommends them. So if calcium is not the whole answer, where does that leave someone with osteoporosis? It leaves us with a much more realistic picture. First, you need to understand how serious your bone loss actually is. A DXA scan can provide important information. Your fracture history matters. Your age, sex, medical conditions, and medications matter. If you have had a fracture from a relatively minor fall or impact, that is not something to ignore. And if you are taking a medication known to affect bone, that should become part of the conversation. Then comes the mineral system. Magnesium deserves attention not because it is a miracle supplement, but because it is involved in bone biology and vitamin D and PTH regulation. The best starting point is usually food. Green leafy vegetables, nuts, seeds, legumes, and whole grains can contribute magnesium to the diet. The recommended amount for adults varies by age and sex, and it is nowhere near the extreme doses promoted in some online videos. If you use a supplement, remember that high supplemental magnesium can cause diarrhea and, in people with impaired kidney function, serious problems. That is exactly why a blanket recommendation to take huge amounts is a bad idea. And the same caution applies to vitamin D. If you are deficient, correcting that deficiency matters, but extremely high doses are not automatically better. For adults, 4,000 IU per day is the established tolerable upper intake level for total daily vitamin D intake. But that is an upper limit, not a target dose. Higher doses may sometimes be used under medical supervision for a specific medical reason. So if somebody tells you that every person with osteoporosis should automatically take 20,000 IU every day, stop and ask a much more important question. Based on what medical evaluation? Bone health is too important to gamble on internet dosage advice. Now we come to the part of the story that may be even more important than the calcium tablet sitting in your kitchen cabinet. Your bones need a reason to stay strong, and that reason is movement. Bone is living tissue, and it responds to mechanical stress. When you spend most of your day sitting, your skeleton receives a very different signal than it would from regular walking, resistance training, and other appropriate weight-bearing activity. This does not mean somebody with severe osteoporosis should suddenly start lifting the heaviest weights in the gym. That could be dangerous. The right exercise depends on the person's fracture risk, physical condition, and medical history. But the principle is simple. A body that never challenges its bones is not sending the same strengthening signal as a body that moves regularly. This is one reason osteoporosis treatment is often more than a supplement conversation. Imagine trying to rebuild a house while ignoring the foundation, the construction workers, and the building design, then focusing only on one bag of cement. That is what happens when people treat bone health as calcium in, strong bones out. Your skeleton is constantly receiving signals from your hormones, your muscles, your nutrition, and your activity level. You have to look at the whole system. And there is another factor that many people do not take seriously enough: protein. Bone is not made of calcium alone. The organic framework of bone includes proteins. And adequate protein intake is important for overall bone health, especially as people age. If someone is eating very little protein and losing muscle, they are dealing with two problems at once. Less muscle can mean worse balance and a higher risk of falls. Poor nutrition can also make it harder for the body to maintain healthy tissue. This is why a balanced diet matters. Not because one food is a magic bone builder, but because the body needs raw materials to repair and maintain itself. Now let's talk about stress, because the word stress is often used so loosely that it loses meaning. The body does respond to chronic physiological stress, and hormones such as cortisol are involved in many processes. Long-term exposure to glucocorticoid medications is especially relevant to bone health because these drugs can contribute to bone loss. But I do not want to turn this into another internet myth claiming that every stressful day is directly dissolving your skeleton. That is not how the science should be explained. The real point is that sleep, physical activity, nutrition, medication use, and medical conditions all influence the environment in which your bones are trying to maintain themselves. Now, what about osteoporosis medications? This is where many people become suspicious. They hear the name of a drug, read that it affects bone cells, and assume the medication is covering up the real problem. Let's use alendronate as an example. Alendronate belongs to a group of medications called bisphosphonates. These medications reduce the activity of cells responsible for breaking down bone. They are not simply pouring calcium into your skeleton. Their purpose is to slow excessive bone resorption and reduce fracture risk in appropriate patients. That is a very different strategy from taking a mineral supplement. Then there are anabolic or bone-building treatments, such as teriparatide, which is related to parathyroid hormone biology. The important point is that the same hormone system can behave very differently depending on the pattern and context of exposure. The body does not respond to every biological signal in a simple more is bad, less is good way. This is why a medication that influences a hormone pathway cannot be fairly compared with a chronic abnormality of that hormone pathway inside the body. If you have osteoporosis, the correct question is not, do I hate medications? The correct question is, what is my fracture risk? What is causing my bone loss? And which treatment has the best evidence for my situation? This matters because untreated osteoporosis is not harmless. People sometimes spend months or years chasing supplements while ignoring a high fracture risk. A hip fracture or vertebral fracture can change a person's mobility, independence, and quality of life. If a doctor recommends medication because your fracture risk is high, do not stop it or replace it with internet advice without discussing that decision with the prescribing professional. Now, let's return to vitamin K, because this is another area where online health content often becomes extremely confident. Vitamin K is important in bone biology, and some studies have explored vitamin K supplements and bone outcomes. But current evidence is not strong enough to honestly tell every person with osteoporosis to take enormous doses of vitamin K2 as a guaranteed solution. More research is still needed to clearly understand how vitamin K supplements affect bone health and osteoporosis risk. And if someone takes a blood-thinning medication such as warfarin, vitamin K can be especially important to discuss with a healthcare professional because vitamin K interacts with that treatment. So yes, vitamin K belongs in the conversation. No, that does not justify inventing a universal megadose protocol. This brings us to a very important idea. Your body is not a collection of isolated supplement bottles. Magnesium does not operate alone. Vitamin D does not operate alone. Calcium does not operate alone. Vitamin K does not operate alone. Hormones, kidneys, intestines, bones, muscles, and the nervous system are all connected. If you take one nutrient in a massive amount while ignoring the rest of the system, you are not necessarily improving the outcome. Sometimes you are simply creating a new problem. Kidney stones are a perfect example of why this matters. Calcium stones are the most common type of kidney stone, but stone formation is influenced by multiple factors, including urine concentration, calcium, oxalate, citrate, and other conditions. Dehydration can matter. Individual metabolism can matter. Medical history can matter. A person with a history of stones should not blindly copy a supplement routine from a random video. And the same is true for magnesium. Magnesium may be involved in the chemistry of kidney stone formation, but claiming that massive magnesium doses are a universal antidote would be medically irresponsible. The exact type of stone and the person's kidney health matter. So what should a person actually do if they are worried about osteoporosis? Start by refusing to think in slogans. Do not assume calcium is bad. Do not assume calcium is the complete answer. Do not assume magnesium will fix everything. And do not assume a supplement routine found online can replace a proper evaluation. The first step is to understand your actual bone status. If you have risk factors, your doctor may recommend a bone density test. A DXA scan can help identify osteoporosis and monitor treatment. Your fracture history is important. If you are over a certain age and have experienced a fracture after a minor fall, that should be taken seriously. You may also need an evaluation for secondary causes of bone loss. In some people, osteoporosis is not simply aging. It may be related to hormones, medications, digestive problems, kidney disease, or other medical conditions. The second step is to look at your diet honestly. Are you eating enough calcium-rich foods? Are you getting adequate protein? Are you eating foods that provide magnesium? Are you severely restricting your diet? Are you relying on coffee, packaged food, and supplements while barely eating real meals? These questions may sound simple, but they are often more useful than chasing a new bottle every week. The third step is to examine your medications. If you have been taking corticosteroids for a long time, that matters. If you use acid-suppressing medications, do not stop them on your own, but ask whether the medication and dose are still appropriate for you. Your doctor may need to consider your full bone risk profile. Sometimes the most important bone supplement is actually identifying a medication or medical condition that is quietly contributing to bone loss. The fourth step is movement. Walking can be useful, weight-bearing activity can be useful, resistance training can be valuable, but the exercise must match your current condition. If you already have severe osteoporosis or a history of vertebral fractures, get appropriate guidance before beginning an aggressive program. The goal is not to prove how tough you are. The goal is to give your bones and muscles the right signal without creating an avoidable fracture risk. And finally, do not ignore calcium. This may sound like a contradiction after everything I have said, but it is actually the point of the entire story. Calcium is essential. The mistake is treating calcium as the only mineral that matters. If your diet is low in calcium, you may need to improve your intake. Many people can meet their needs through food. If they cannot, a supplement may be appropriate, but the amount should be based on your total intake and medical situation, not on the belief that more calcium automatically means stronger bones. The same logic applies to vitamin D. If you are deficient, correcting the deficiency is important, but more is not always better. A supplement should be used thoughtfully, and very high doses should not be taken routinely without medical direction. If you have kidney disease, a history of kidney stones, abnormal calcium levels, or a condition affecting parathyroid function, This becomes even more important. So, can calcium actually make osteoporosis worse? The honest answer is more complicated than the shocking headline. Calcium itself is not a villain, and osteoporosis is not simply caused by a lack of calcium. In certain situations, excessive or unnecessary calcium supplementation can create problems, including a possible increase in kidney stone risk. And the cardiovascular evidence around supplements has been debated. But the biggest danger may be the way people think about calcium. They believe they have found the answer, so they stop looking for the real cause. Your bones are living tissue. They are constantly being broken down and rebuilt. Magnesium helps support important systems involved in bone biology. Vitamin D helps regulate calcium metabolism. Parathyroid hormone helps maintain calcium balance. Protein provides essential building material. Movement tells bone that it still needs to remain strong. And medications may be necessary when fracture risk is high. Every piece matters. If you have osteoporosis, the goal should not be to panic and throw away your calcium. The goal should be to stop treating your skeleton like an empty container that can be filled with one mineral. Find out why your bones are losing strength. Check the bigger picture. Make sure your diet, vitamin D status, medication history, physical activity, and medical conditions are all being considered. And before you start a high-dose supplement routine or stop a prescribed osteoporosis medication, speak with a qualified healthcare professional who knows your medical history. Because the most dangerous thing about osteoporosis may not be the calcium tablet itself. It may be believing that one tablet can explain an entire disease.